Pulmonary hypertension, a condition that not only affects millions worldwide, also claimed the life of the legendary singer Natalie Cole. Today, we explore the battle against this life-altering disease. In 2024, pulmonary hypertension is estimated to affect 1% of the global population. The condition, often marked by shortness of breath, fatigue, chest pain, it can lead to heart failure if left untreated. Natalie Cole, who passed away due to complications from this disease, is a reminder of its severity. But thanks to biotech innovation, there's hope. From cutting-edge gene therapy research to digital health monitoring device and AI-driven diagnostics, the landscape of treatment is rapidly evolving. Targeted therapy, precision medicine, and even emerging biomarker discovery are paving the way for more personalized care. With early diagnosis and personalized treatment, patients are experiencing better outcomes.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund Evergrowth Biohealthcare Capital, we invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by using that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Today, our chairman of the Medical and Scientific Advisory Committee, Dr. Van, will present on the topic of hypertension.
As you know, hypertension is a term we label for high blood pressure. Pulmonary hypertension is a type of high blood pressure that affects the arteries of the lungs.
Dr. Van started out by defining this condition, and this is a condition in which there's high blood pressure in the pulmonary arteries of the lungs, and it will affect both the lung as well as the right side of the heart.
Definition that you can see here categorized by high blood pressure in the pulmonary arteries affecting the lungs and also the right ventricular function.
Dr. Van discussed the prevalence of this condition. The global prevalence is 1% of the global population. There's 23 cases per 1 million people per year. And for new cases, there are 5 new cases per million people per year. Next, Dr. Van discussed the different type of pulmonary hypertension, and they are classified into group 1 to 5, which each group have different causes.
As you see, group 1 occur as idiopathic or associated with other conditions that including the heart as well. And then group 2 is really also labeled as, significantly for the left heart disease. And then group 3 of the pulmonary hypertension occur from lung disease. And then group 4 occur because of recurrent blood clots to the lungs, result in damaging to the pulmonary vascular musculature, result in elevated blood pressure inside the pulmonary vessels. And then group 5, pulmonary hypertension occur because of multiple mechanisms from systemic to blood disorder to metabolic disorder.
Next, Dr. Ben went into further detail on etiology or cause for pulmonary hypertension. So there are different causes, like there are idiopathic or unknown causes, but the majority of the cause is due to heart disease. Other causes like blood clots in the lung, drug toxin, connective tissue disease, sleep apnea, genetic mutation as well. Effect on the body is that pulmonary hypertension causes right strain of the heart, which can lead to heart failure. And with that, you have decreasing oxygenation level. Systemically, the patient feels tired, like fatigue. They can experience bleeding, like coughing up of blood.
Effects on the body mainly affecting the cardiovascular system significantly. It also can cause decreased oxygen level, result in patient feeling shortness of breath, result in them have cyanosis, and systemically they feel fatigue, tired, they have swelling, dizziness, fainting, also have bleeding episodes such as coughing up blood, and overall reducing the quality of health.
Next, Dr. Van went into more detail on signs and symptoms of this condition, like shortness of breath, fatigue, chest pain, coughing up blood, so on and so forth.
Symptoms, as you can see here, shortness of breath, fatigue, chest discomfort, swelling of abdomen, ankles, and legs, and also bleeding from coughing up blood there. Signs when we do physical exam: heart murmurs, arrhythmia resulting in rapid heartbeat. We have heart failure resulting in enlarged veins in the neck. Patient also appears cyanotic. A patient also have enlarged liver and then swelling in the legs as well.
Dr. Van discussed how this condition is diagnosed, and this is much more complex than other conditions. We start out with a history and physical exam, and then we would order a battery of tests like chest x-ray, ECG, echocardiogram, CT, MRI of the chest, getting a pulmonary function test, a blood test, and then the gold standard for diagnosis is the right heart catheterization to get the blood pressure in the right side of the heart. Next, Dr. Van mentioned about the different kind of treatment like therapeutic lifestyle changes like diet and exercise, oxygen therapy, vasodilator therapy, prostaglandin analog, PDE5 inhibitor, or the Viagra, which can also be effectively used to treat pulmonary hypertension. Then we have anticoagulant, diuretic. There's also other mechanical intervention like wearing BiPAP, CPAP. Now the treatment depending on the specific cause. Dr. Van then went over the commonly prescribed medication.
Commonly prescribed medication, as you can see here, the EPO type of medications, and I list there Flolan, Veltri, along with their manufacturer, and then we have Bosentan, which is Tracleer, and then the tadalafil medications, as we aware you've been using for ED.
And then lastly, we discussed about the prospective investment for this. We came to the conclusion that the ideal stock to invest in this niche would be biologic, but it has to have a novel or different mechanism of action. It has to show efficacy. And the best one to invest is one that is developed by a young, small cap growth biotech company, with this drug being like the leader of the pipeline or the crown jewel of the pipeline. You want to capture this lucrative opportunity while investing in the innovation that delivers hope to the patient, but you either don't have time or you don't have the expertise. Reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.